And wrapping up tonight's Top 10 at 10, Detroit medical students are working to bridge the healthcare gap for some of the city's most vulnerable. They're hitting the pavement to provide street care, helping people get refills, checkups, and even access to basic medications. 7 Action's reporter Jen Shaw's tagged along with the group tonight, and she's live downtown Detroit with a story you'll see only on Action News. Jen?
Yeah, Alan, for members of Detroit's street care team, this right here, the street, is their clinic. As you mentioned, we tagged along with them tonight for one of their weekly rides. The goal of this program is to bridge that healthcare gap and meet their patients where they are, in every sense of the word. They hit the pavement every week, come rain, snow, or shine. They're medical students with Detroit Street Care, a mobile clinic providing healthcare access to some of the city's most vulnerable, people living on the streets.
Sometimes we spend our evenings passing out blankets or socks on the street. Sometimes we end up dropping our patients off at the emergency room because it's out of our hands.
It's an all-volunteer program run by students like Ellie Small.
My name's Ellie. We're all medical students and we're with the street medicine team.
Oftentimes, the students are seeing the same patients who don't always have dire medical emergencies, but rather are missing basic necessities for healthy living.
We can clean it up for you. Someone's not going to be worried about taking their hypertension medication every day if they don't know where they're getting their next meal.
These student doctors need to build trust before they can start providing care. It starts with something simple, how they approach their patients.
You're meeting your patients in their home, whatever their home might look like.
This man needed his feet wrapped, but in the past, the groups had to triage emergency situations, like a car crash they witnessed on a recent ride.
At that moment, we were like, oh, geez, we're the first responders. We're the first ones on the scene.
The weekly rides start at a neighborhood shelter and go all around the city.
Do you go inside anywhere at night?
Follow-ups are crucial.
We know where they're going to stay. We will always ask them, will you be here?
Who prescribes you the insulin?
Many of their patients have insurance, but are either underinsured or don't have the resources to get what they need.
I'm going to text Dr. Bryce right now and let him know we saw you.
Detroit Street Care aims to close the gap while providing real-life experience to these doctors in training.
You might not be able to change the whole system in a night going out on the streets and passing out meds and blankets, but you can change that one person's day or week or year or maybe their life. And if you can impact one person, that's huge.
Now, this program has been up and running for about 5 years. There's similar street care programs at both the University of Michigan and Wayne State. They are always looking for donations, including medical supplies. For more information, just head to our website, WXYZ.com. Reporting live tonight in downtown Detroit, Jen Shaw's 7 Action News.
Great to see that help, Jen. Thank you.